Good evening, my lovely people. Still discussing about one of the longest topic we have ever discussed, which is family planning. But I don't regret taking more minutes or much time on this topic because it's a very important one and many of you are waiting for it. I do appreciate those people who are appreciating my work and thanking me on the way I've discussed this topic, because many of you, especially ladies, have got to understand what it takes or make a decision on the best type of family planning or birth control they can go for. So before I continue, I always appreciate your support. I always appreciate each and every one who is doing anything, whichever little it is, to make this channel go forward. Be it by subscribing, liking, sharing, and also commenting on our videos. Let's get back to our discussion, whereby today we'll be looking at what to consider when switching birth control method, or what to consider before you change your birth control method. When switching birth control method, or when you and your doctor decide it's time to switch pills, there are a few things you should keep in mind. Make sure you discuss each of the topics with your doctor before you fill the prescription. When you and your doctor decide it's time to switch pills or change pills, there are a few things you should keep in mind. Make sure you discuss each of these topics with your doctor before you fill the prescription. Number one, how to transition. How to transition. Transition means changing from one pill to another, or changing from this kind of a pill method to another. When switching between pills, most doctors recommend that you go straight from one pill type to another with no gap or placebo pills in between these two methods. How to transition. When switching between pills, most doctors recommend that you go straight from one pill type to another with no gap or placebo pills in between. And I'll explain to you what placebo pills are. This way, your level of hormones doesn't have a chance to drop and ovulation can't occur. This way, or when you switch direct from this kind of pill method to the other without having a gap in between, there is no way your level of hormones will have a chance to drop and ovulation can't occur. Remember, if there is no ovulation, no pregnancy. A point to note, what are placebo pills? Oh, what is placebo? Placebo is any treatment that has no active properties. Any treatment that has no active properties, such as sugar pills. Any treatment that has no active properties, such as sugar pills. There are many clinical trials where a person who has taken placebo instead of the active treatment reported an improvement in symptoms. There are many clinical trials or instances whereby a person who has taken placebo instead of the active treatment reported an improvement in symptoms. Belief in a treatment may be enough to change the course of a person's physical illness. Just the belief may be enough. That's why we always encourage clients or patients to believe in the treatment, because if you won't believe in it, maybe it won't have an impact or a positive impact in your body. What are placebo pills? Placebo pills help people make a habit of taking the pill regularly. So they just help or assist someone to develop the habit of taking the pill regularly or without missing. Placebo pills consist of inactive pills which do not contain hormones and are also called sugar pills. Placebo pills consist of inactive pills which do not contain hormones and are also called sugar pills. Point number 2, the next thing you consider when changing or switching between pills, the backup plan. The backup plan, or how are you going to protect yourself from getting pregnant while switching methods? If you go straight from one pill to another without a gap, you may not need to use a backup plan or other form of protection. If you go straight from one pill to another without a gap, you may not need to use a backup plan or other form of protection. However, to be safe, your doctor may recommend you to use a barrier method or other form of protection for up to 7 days. If you go straight from one pill to another without a gap, you may not need to use a backup plan or other form of protection. However, to be safe, your doctor may recommend you to use barrier method or other form of protection for up to 7 days. A point to note: some providers recommend that you wait an entire month before having unprotected sex. Some providers or doctors recommend that you wait an entire month before having unprotected sex. Ask your doctor what's best for you. Always ask your doctor what's best for you. This marks the end of our video today. Thank you for being with me. Thank you for holding my hand, and thank you for supporting this channel. Let's meet in the next video.